You know, when you hear the word menopause, does it bring up more questions than answers? If so, you are definitely not alone. So what if we could flip that script? What if we could turn all that confusion into real, actionable empowerment? Let's dive in and unpack one of the most misunderstood experiences out there.
Does that sound familiar? I mean, that quote from Dr. Mary Claire Haver just hits the nail on the head, right? It perfectly captures that feeling so many people have. That sense that even when your life hasn't changed at all, something deep inside your body absolutely has.
And look, this isn't just you. It's not some isolated feeling. We're talking about over 1 billion people around the globe who are going through menopause right now. It's this massive shared experience. So why on earth does it so often feel like you're going through it all by yourself? Well, that brings us to our first big topic. For something that affects literally half the population, there is a shocking lack of good information and, frankly, a long history of being dismissed by the medical world. So let's get into why that is. I mean, you're not going to believe this, but this was a real term used by doctors. Dr. Haver actually talks about how during her training, physicians would call patients with a long list of these kinds of vague symptoms, WW. And yeah, that was short for whiny woman. It just goes to show you how deep this dismissal really runs. And if you need proof, just look at the data. This chart says it all. If you go look for medical research on pregnancy, you'll find more than 1 million articles. Pretty comprehensive, right? But for menopause, you get less than 100,000. That means we're putting less than 10% of the brain power and funding into a phase that's going to make up a full third of many people's lives. It's just wild. Okay, so to really get what's going on inside the body, we have to talk about the main character in this whole story, estrogen. Seriously, it is the key that unlocks absolutely everything else. This timeline, wow, it really shows you the biological engine driving this whole change. We start out with about 1 million eggs when we're born. But get this, by the time you're 30, 90% are gone. And by 40, only about 3% are left. That massive drop is what kicks this whole process into gear. And here's the so what of all that. As that supply of eggs starts to run out, the ovaries, which are basically the body's mean estrogen factories, they slow down their production and eventually they just close up shop. And that leads directly to what's called estrogen deficiency. Now, a lot of us think estrogen is just about having babies, right? Well, not even close. Think of it more like the oil in your car's engine. It's a crucial ingredient that keeps everything running smoothly. There are estrogen receptors everywhere, in your brain, your bones, your heart, where it acts like this powerful anti-inflammatory and keeps things in check. Let that number sink in for a second. After menopause, the level of your body's most powerful and important estrogen, called estradiol, drops to less than 1% of its peak level. This isn't just a little dip, folks. It is a biological cliff dive. So what does this massive hormonal shift actually feel like in your day-to-day life? Most people hear menopause and think one thing, hot flashes. But the truth is, losing this key ingredient affects your entire body in ways that might totally surprise you. Okay, be honest. When I say menopause, what's the first thing that pops into your head? It's hot flashes, right? For most of us, it is. But they are just the tip of the iceberg. And they're often the most obvious symptom just because, well, you can't really blame them on anything else. But get ready for this because the real list is so much longer. We're talking about new anxiety, that frustrating brain fog, achy joints, frozen shoulder, weird heart palpitations, even ringing in your ears or getting urinary tract infections all the time. All of these can be traced right back to estrogen loss. So many people suffer for years without ever connecting the dots. This chart really connects those dots for us. See, in your joints, estrogen is your natural anti-inflammatory. You take it away and you get pain and stiffness. In your heart, it helps keep things calm and regular. Lose it, and you can get those palpitations. And in your bones, it's the master regulator. Without it, bones can become fragile and weak. And this isn't just about comfort. It can be life or death. That number, 29%, that's the percentage of women over 65 who die within 1 year of fracturing a hip from osteoporosis. And the most heartbreaking part, for most people, this kind of bone loss is completely preventable. Okay, so now that we understand the what and the why, let's get to the good stuff, the how. How do we deal with this? The great news is there is a clear evidence-based toolkit that you can use to manage this whole transition and protect your health for the long run. Dr. Haver breaks it down into 3 main pillars. It's super straightforward.
It all starts with the foundations, what you eat and how you move. And from there, you can explore the really powerful medical options that are available today.
All right, let's just go there. Let's talk about the big, scary elephant in the room, hormone therapy. For decades, there's been this cloud of fear around it, all because of one flawed study from back in the early 2000s. But here's the reality. Modern science has shown that for most healthy people, especially in the first 10 years of menopause, hormone therapy isn't just safe, it's actually protective for your heart and your bones. And when it comes to nutrition, it's about being strategic. These are the heavy hitters you want to focus on. Fiber is food for your good gut bacteria. Magnesium is huge for sleep and anxiety. Omega-3s are fantastic inflammation fighters. And vitamin D, which is really a hormone, is something most of us just don't get enough of. And I love this slide because it nails a crucial mindset shift we have to make about exercise. The goal is no longer about being skinny, it is all about being strong. Things like resistance training and lifting weights are non-negotiable for keeping the bone density and muscle mass you're absolutely going to need as you get older. So when you put all these pieces together, you can really start to see this whole phase of life differently. It is not the beginning of the end, not at all. It's a real chance to grab the steering wheel of your own health in a powerful new way. And that brings us to this really important idea, health span. We all talk about lifespan, right? How long we live. But what about health span? How many of those years are we actually healthy, vibrant, and feeling good? That's the real goal. This quote just says it all, doesn't it? Menopause is inevitable. Suffering is not. The biology is going to happen, one way or another. But just accepting the joint pain, the brain fog, and the bone loss as your new normal, that's not a given. That is a choice. So ultimately, this isn't a story about loss. It's a story about gaining knowledge, gaining tools, and building a foundation for a future that is long, strong, and healthy. So the real question is, what's your first step going to be?